So what's the main cause of androgenetic alopecia, as we call it, or male pattern hair loss, or just genetic hair loss? And that's the typical hair loss that you can see when a male starts to lose the triangles or a big crown or everything. So one of the main culprits for that type of hair loss is a byproduct of testosterone, which is known as DHT. So all day, every day, testosterone is flowing around and bathing every cell in the body, and it breaks down into a waste product called DHT. And this DHT actually has an effect on hair if you've inherited the genes for it. So for example, some people inherit DHT receptors here, some people in the crown, or some people all over the head. And what DHT does is over time it destroys the follicle. And at first they become very thin, so people notice their hair's thinning. Then they shrink almost to a piece of fluff, which is known as a vellus hair. And this is all due to the action of DHT and the follicle. So our next step would be how do we block this DHT? There are pharmaceutical drugs to block this, but they're not without their issues. And they're on prescription, and some of them have quite severe side effects because of blocking the DHT. So I love these natural products that nature's actually given us to block DHT. And there are a whole lot of them in things like saw palmetto, nettle roots, panax ginseng, and beta-cytosterol. And if you combine them all, you have a far safer and more natural way of blocking DHT and minimizing its effects, its deleterious effect on hair. So the Trichotin DHT inhibitor, mainly for men, is the product that's got all those components in it to block the DHT. The best time to take a DHT inhibitor is actually about 30 minutes before you go to bed, so it mitigates the whole night of DHT destroying the follicles. Luckily with this, it's only one capsule, so in other words, one capsule 30 minutes before bedtime. I often get asked about side effects and warnings. One of the biggest concerns with DHT blockers is it going to affect libido, sex drive, or cause erectile dysfunction, which some of the pharmaceutical drugs do? And the answer is you're far safer off with a natural DHT inhibitor, and you can actually have a beneficial effect on libido because nettle root, one of the ingredients, actually increases your free testosterone. So you're getting the benefit of having less DHT around the follicles, but a slight increase of free testosterone because of the nettle roots. People who shouldn't use the product, I would not recommend this under the age of 16, but it can be used for those very young hair loss patients once they turn 16. Although it's a male-focused product, I always need to mention not in breastfeeding or pregnancy, and anyone on chronic medication, including prescribed hair medication, should check with their doctor, because there can definitely be interactions. And as with any product, you can have an allergy to any ingredient. So any known allergies to any of the ingredients, although it's very rare with this product. Selling points for DHT inhibitors would be asking your clients or patient if they've noticed any hair loss, if they've found that their hairline has gone up, or if in the lift they can see the crown. Or if they buy their first convertible and they get sunburnt on the crown, that's when they often notice it. But another way of putting it, because some people say, oh, I've only lost a bit of hair, is that the earlier you start, the better. It's far easier to keep what you've got than to regrow hair. So if people are just starting to notice hair loss, it's actually the ideal time to start rather than to wait. But it's never too late to try, but just try to get it early. So when it comes to sales and selling these hair loss products, they almost sell themselves because almost everyone at some stage of their life has an issue with their hair or knows someone with an issue with their hair. So the first thing is having the product in a visible place. People see something for hair and they often ask questions. But you can also lead the sale by just mentioning, have you seen any hair loss? Have you seen thinning in your photos over time? Or is there excess hair in your brush or going down the plug when you're bathing? And that often just triggers a thought in the client or the patient's mind. And then you've got the solution to start their hair loss repair journey.